Hey everyone, it's 5 o'clock on Tuesday. It's Lucy McBride from Washington, D.C., broadcasting live. This is my unedited, unscripted weekly podcast, and I'm thrilled you're here. Today, we're going to be talking about the broken healthcare landscape in this country. Why it's so broken, what the manifestations are, how it affects you in your daily life, particularly when you're sick or when a loved one is sick, and what you can do about it from a systemic level to a self-advocacy level. So this is a tough subject for people. This is a tricky subject to talk about because let's just name the elephant in the room. If you can afford it and you have means, you can get generally better care. But in my book, everyone in this country deserves access to medical care, to primary care as a medical home. It shouldn't just be for people who can afford it. So here we are in this landscape. I wrote a newsletter this morning about a patient who called my office last week. She had been told by the receptionist at her doctor's office that her doctor retired. She didn't get the memo. And she had chest pain and had been to the urgent care, and she should follow up with her primary care doctor. Well, her primary care doctor had retired. So what is she to do? So she calls my front desk. Desperate. Totally understandable. EKG was normal in the ER or urgent care, I think it was. What was she supposed to do? So this is not unusual. This happens all the time. My front desk fields calls all the time, and we try to accommodate as many patients as we can. But this is happening thousands of times a day across the country. 100 million Americans in this country do not have access to a primary care provider. And by 2036, we're projected to be short by something like 68,000 physicians. With an aging population and with doctors leaving the profession and fewer primary care doctors to service patients' basic healthcare needs, we are in a bad place. So today, what I want to do is not paint a gloom and doom picture because we see a lot of that on TV already. We hear about this on the news. It's also not to sugarcoat the situation. It's to give you some actionable advice on how to squeeze the juice out of the healthcare system that is broken in many ways, but not dead. How to squeeze the juice out of the system, how to squeeze the juice out of your appointments with your doctor if you're lucky enough to have one, and how to be your own best health advocate. It's not fair that you have to be like your chief medical officer and chief medical advocate, particularly when you don't have a primary care doctor, but that's just the reality of where we are. So I'm going to talk a bit about the landscape, some ideas on how to help yourself, help your loved ones, and then I'm going to open up for questions at the end. So the landscape, how did this happen? Well, there's a long history that I won't go into now, but let's suffice it to say that the pressures on doctors from insurance companies to see patients in volume is enormous. So doctors are pressured to see volumes of patients and not to provide necessarily quality care. Doctors and primary care providers, at least the ones I know, went into the field of medicine to provide care, to provide for human beings. So I am very careful, because I think it's appropriate, not to blame primary care providers or blame doctors. No one in medicine today went into medicine because they were going to try to get rich or because they were just trying to phone it in. No, the system has made it so difficult and the reimbursement rates are so low from insurance companies that in order to pay the rent, doctors have to see patients in 15-minute increments. They're often rushed, and there's just no way you can see like an 80-year-old patient, like someone I saw this morning, in a 15-minute slot and provide meaningful care. So primary care, as a result, has become, in many ways, a gatekeeping apparatus. It's supposed to be primary care ideally is supposed to be a hub for problem solving, a place where your primary care provider, doctor can manage everything from diabetes to hypertension to cardiac disease to kidney insufficiency to the flu, where we see mental health issues, behavioral issues, and we connect the dots between those things, right? Connect the dots between how your sleep and your stress affect your blood pressure, how your relationship with your spouse affects your relationship with food and alcohol. So, in its ideal form, and this is really what I went into medicine to do, and what most of my colleagues went into the field of medicine to do, and particularly in primary care, is to help see the whole person, the 360-degree vantage point on the whole person, to help people make sense of their medical data, their social emotional health, their social determinants of health, and to provide them with evidence-based guidance, and then to only refer out to specialists when the primary care doctor has reached the limit of their knowledge or they need a test that the primary care doctor can't do. So in its ideal state, primary care is a hub for problem solving, and where people are sent to specialists only when, like, I don't do stress tests, I don't do cardiac catheterizations in my office, I don't do MRIs in my office. And I try not to send out to orthopedists unless I've troubleshot the back pain or knee pain or hip pain or whatever it is, as far as I can go with it. But what has happened is that because primary care providers are so short on time and there's so few primary care doctors, they tend to, through no fault of their own, become just referral mills, right? So you have a problem, here's a referral. You have a symptom, here's a prescription. Again, this is not the fault of the providers. The fact of the matter is that if you're trying to see volumes of patients to make sure you're paying the rent, you're trying to get through the day without so much moral injury that you want to leave medicine. You're like, look, if someone has high blood pressure, you send them to the cardiologist. If someone has high blood sugar, you send them to the endocrinologist. If someone has toe pain, you send them to the toe doctor. By the time patients are in their 70s or 80s, they often have like a doctor for every body part, a pill for every complaint, and no one is talking to one another. Ideally, the cardiologist and the internist, the primary care and the endocrinologist would be talking to each other, coordinating care. What this means is that patients are left to do this kind of care coordination on their own, and they're left having to advocate for themselves with, force, like they shouldn't have to do. But that is just the reality of where we are. When I worked in the Hopkins ER in the 2000s, we weren't just providing emergency care for like heart attacks and stroke. We were providing primary care for people whose insulin prescriptions had run out. We were providing basic care for people with UTIs, urinary infections, who couldn't get into their gynecologist. We were providing psychiatric care for people who couldn't get off a wait list for a psychiatrist or whose primary care doctor, A, didn't exist, or B, didn't have time to talk to them about mental health. So ERs have become de facto primary care. Specialists are now being asked to do the work of primary care doctors, and primary care doctors are leaving medicine in droves. So I said I wasn't going to paint a grim picture, but that is the grim picture. The good news is there are things you can do. So, oh, good. I'm glad it's healing, Grace, because let me just speak to that for a second. There's so much, I'm going to use this word a lot. There's so much moral injury out there in the healthcare space because doctors feel shitty. I'm just going to use that word. When they aren't given the tools and time to build a rapport, build a relationship, and provide the kind of care they want to provide. Like, again, no one went into the field of medicine to just do drive-by medicine or like just stroke a pen on a prescription pad and say, see you next year, or to rush out the door. And then patients feel not heard. They feel not understood. They feel like they're, a bag of body parts, a set of complaints to solve, and a nuisance sometimes. So it's the system is really bad. It's really bad if you haven't seen it already for your own eyes. It's really anti-patient and anti-doctor. It's pro pharma and pro insurance. It just is. So until we reinvent the healthcare system, until we make primary care spending a priority in this country, right now, only 5% of primary care dollars are spent on, sorry, let me say that again. Right now in the US, only 5% of healthcare spending is spent on primary care. 95% is on damage control. So I have lots of thoughts. I've written lots of op-eds about what I think we need to do. And I think it's pretty plain and obvious, and it's not just me who thinks this, that we need to center primary care in our healthcare system. We need to make sure everyone has unfettered access to a primary care medical home where you can get in for urgent visits, you go in for an annual physical, and your doctor has time, where you build a relationship, you build a rapport, and you can troubleshoot things from depression to diabetes to dementia. That should happen. It saves money. It's the right thing to do. We just have to, figure out politically who has the will to do it. And it may be in the private sector that has to do it. So there's a lot of exciting innovation happening in the tech space, particularly with tech entrepreneurs who understand the role of patient and doctor. They understand that you can use technology, you need to use technology to elevate, not eliminate the patient-doctor relationship. So tech entrepreneurs who understand the foundational element of patient-doctor rapport and relationship are the ones who will succeed in reinventing healthcare, and I really hope they do, and I'm optimistic, and I've got my ear to the ground. This is on my agenda, is to be part of this movement to help reinvent healthcare in this country, but that's not gonna happen for a long time. In the meantime, you're stuck sitting on hold, listening to elevator music, trying to get through to somebody. You're stuck wondering if this chest pain is something that warrants an urgency or an urgent care visit, an ER visit, or ignore it. And you're stuck maybe not having a primary care doctor who's available to go through just well person care. So what are your options for primary care? So you can use your insurance, of course. Like that's the ideal, right? Ideally, and in an ideal world that we do not live in, insurance would pay for you to have a primary care doctor who has time with you. So, I mean, if you haven't done this already and you don't have a primary care doctor, look on your insurance and see who participates with your insurance in your neighborhood. And then look on the local listservs, look for reviews of these doctors. Let me just say a sidebar about reviews. You can have one person who just is mad as a hornet about you and they can ruin all your reviews. So I would be careful about interpreting reviews with, thinking they're all 100% accurate. But I think I would ask people you trust, ask your dentist, ask your, cardiologist, who do you like for primary care? Ask your neighbors, your friends, who they like, and see if that person takes your insurance. FQHCs are community healthcare centers. They provide comprehensive care regardless of your ability to pay. findahealthcarecenter.hrsa.gov. findahealthcenter.hrsa.gov is a way to find an FQHC, which is a federally funded community health center, which in its best incarnation is designed to provide comprehensive care, behavioral health, whole person primary care. And there often are shorter wait times to get into the FQHCs. Then there's direct primary care. So direct primary care is actually what my practice is, DPC. Some people call it concierge medicine. I don't like that word because it implies that I'm serving like caviar to people or something, but what it is basically a system where patients pay an annual membership so the doctors have a smaller patient panel. So you have time with your doctor. It's that simple. It's the kind of medicine that I thought I was going to be practicing when I became a doctor and realized in some of the hospital systems I worked in that was going to be very difficult. The problem with this is the obvious. It's expensive. It's expensive as all get out. The prices vary based on geographic location, et cetera, but it's expensive. It's not accessible to all. And at some point, I think that kind of medicine should be accessible to all. I think that kind of medicine where doctors have time to understand the patient's story, their biographic data, and not just their biometric data, and how they interrelate, that should be accessible to all. But DPC is a growing phenomenon. And doctors are finding that they have to leave the system to be able to provide good primary care. And patients are deciding in many ways that even if they're not rich, that they want to spend their money on their health. I'm not trying to suggest that DPC doctors are always better than doctors in the system. Not at all. I'm just saying that you generally will have more time with your doctor, and you generally will have more access to your doctor. But there are trade-offs there for sure. So nurse practitioners and physician's assistants, in my experience, we have one in our practice who's amazing, can be excellent primary care providers. It really depends on their level of experience, their knowledge base, their training. And just like is the case with doctors, it depends on their level of awareness of what they know and what they don't know, right? I know what I know and I don't know what I don't know. And for me to pretend I know something I don't know would be bad. So whether you're a doctor, a nurse practitioner, or a PA, um, if you're looking for someone who's a PA, like an extender, you want to make sure that they are well trained. They have good reviews from people that you trust and know, maybe even other doctors in your community or other doctors you see. But they certainly can be an excellent resource if you're having trouble finding an MD in your community. Um, I'm loath to recommend like One Medical or MD Live. Like, it's not like I am being paid to advertise them at all. But there are these telehealth options. I'm not recommending them necessarily. I'm just saying that they exist. They exist. They meet an unmet need for people to have access, like in rural areas, or for people with disabilities who can't easily get out of their house or travel, or they have work. They can't travel to see a doctor in person. For a number of reasons, seeing doctors in person can be cumbersome. So One Medical and MD Live and these other kind of online telehealth services can be a good way to get care. Um, at the end of the day, it's important, though, you realize the difference between what is medical care and what is healthcare. So I wrote about that this morning. Medical care, to me, is where you're getting like problem-based, problem-specific treatment. And that is what urgent care does. That is what emergency rooms do. It's what I do as a primary care doctor, too. It's part of my job. But what we're talking about ultimately, and what I'm hoping everyone has access to someday, and what I know you want, is not just episodic, transactional, problem-based care. It's healthcare. Healthcare, which is the concept of patient-centered transmission of evidence-based data and information and shared decision-making with a patient and a doctor that's based on trust and a rapport and an understanding of the person, your particular health risks, your particular tolerance for risk, your particular health goals. And that is what healthcare is. So I think it's important you understand the difference and demand the latter. Now, if you're like my 22-year-old son in New York City who's healthy, like getting a strep test when he has a sore throat at the local urgent care and getting a flu shot in October, which he's got to do, is probably sufficient for healthcare, right? But really not. I mean, who's asking him about, preventive health maintenance? Who's asking him about, depression screening uh, and he's just a 22-year-old kid. I mean, my point is that the minute that any medical complaint becomes complex, or the minute that we become more complicated than a positive or negative strep test, that's when you need healthcare. That's when you need someone who understands you and someone who understands the totality of your different health systems. So again, like, that is a long way away before everyone has access to healthcare like that, unless you're rich in this country. And that is a crying shame. So next, I'm going to talk about advocacy. I'm going to talk about the fact that you have to be a fierce advocate for your needs, given the fact that no one is coming to save you. No one is coming to save you in primary care. Even your primary care doctors, even if you have a good primary care doctor who's paying attention to you, you have to be so self-advocating um, that I wanted to give you some tips on what to look for when you're looking for a primary care doctor. And then once you secure an appointment with somebody, what to ask for and what to do in that appointment. Some of this is self-evident. Like, you guys were not born yesterday, but I thought I would go through some of my thoughts. And then I'm going to answer some other questions, some questions at the end. So when you are evaluating primary care providers, when you're looking at a menu of options of who you might call, like your neighbor recommended this person and your dentist said, oh, I like this primary care doctor. Your listserv said, try this person. First of all, you want to understand access, because you can have the best doctor in the world, but if you can't see them when you're sick, or you can't reach them on the phone when you have some urgent need, it doesn't matter if they're good. So ask the front desk, what's your typical wait time for routine appointments? How do I reach you between visits if needed? Do you have same day sick appointments? So those are key. Those are key. The ability to go, like, what you don't want to have is a nice relationship with the doctor who can see you for your checkup and then is not available in the 364 days a year when you have some issue. So you want both. And I think you can advocate for both, and you should advocate for both. You also want to understand the care philosophy. So some providers haven't identified their philosophy, some don't have it on their website, but I want to make sure that you're understanding that there are care philosophies in different practices. Like, how long are the typical appointments? How do you coordinate with other specialists? Like, how do you conceptualize the patient-doctor relationship? Is that sort of a sidebar issue, or is that central to the services you offer? And what's your approach to preventative care, whole person care? Do you address mental health? Do you think about behavioral health? Those are questions I'd want to know before I landed on a primary care provider. Then there are logistical questions. Do you accept my insurance? If you're direct primary care, what are the details of the membership? What's included in the membership and what's not included? What about after hours coverage? What if there's an emergency on a weekend or a night? I mean, I can't tell you how many times I'm on call for my practice. Like, we rotate who's on call for nights and weekends. And I get calls from patients of our practice, but about a question that their specialist should be available for, but they just disappear when on the weekend, on the nights or the weekends. So just so you know, like, it's okay, but it's not okay. Like, right, like doctors need to have a system to be reachable on a rotating basis for after hours and emergency care. Medical problems don't adhere to a 9 to 5 schedule, if you haven't noticed. What is your refill prescription process? Do you have to have someone come in every time you need a refill? Is there a fee, or is there a charge every time you need a refill? Do you have to sit on the phone? Is there a portal? So you want to understand those three things: access to the provider, what's the philosophy, like, how do you think about healthcare, and then logistics. Okay. When you get an appointment with your provider and you're sitting in the waiting room, or you're sitting in that cold room on an exam table in a paper gown, and you're looking around feeling vulnerable, doesn't everyone hate that experience? Palms sweaty, kind of worried, like, am I going to be judged? Am I going to like this person? It's awful. Before you get there, try to think in advance about what you want to get out of this appointment. Remember, your doctor, even if they're the most well-intended, best-trained doctor in the world, is not going to have the time you need, most likely, especially if you're in the system, in the insurance system. They are going to have a very limited amount of time. So you want to come prepared. Bring a portable health summary. Some of my patients do this, and it's great. But particularly if you don't have a primary care doctor who's a, documenter and coordinator of care and, collator of all records that from your specialists, you need to do this yourself. So maintain like a Google document or a Word document where you can update it every time you have a tetanus booster, every time you get a flu shot, every time you have a new prescription, add it to your list. When the dose changes, update the dose. So you have a living, breathing medical record that you are updating in real time based on your vaccines, based on your medications, based on your medication doses. It's got your allergies listed on there. It has your family history listed on there. Family history of heart attack, stroke, cardiovascular disease, cancer, neurodegenerative disorders, mental health problems, substance use. Write down your habits. How much alcohol do you drink? Do you smoke cigarettes? Did you ever smoke cigarettes? What's your exercise routine? What's your eating habits? What are your eating habits like? Write down how you manage stress. Like, just hit all those points. By the way, this is what my book is about. So I'm not going to go into like 365 pages of what I wrote about, but you want to have a living, breathing document that you update in real time with all of your hard medical data. Again, basic things again are past medical history, your major medical issues, past surgical history, your current medications, your known drug allergies, your vaccinations, your preventative health maintenance. When was your last mammogram, colonoscopy, PSA, DEXA scan, gynecology exam, dermatology exam, ophthalmology exam, the list of your specialists. And then you want to go in, print that out, bring it in. It will save a lot of time with your doctor. Now, you're also going to have some complaints you want to address in the office. You're not going to get those all covered in one visit. So I suggest in advance of your appointment, thinking about the top 3 things you want to get through by priority. What are the 3 things you want to talk about? Cognitive health, metabolic health, and your sore low back. That would be dandy if you got through all those things. Do not expect in a first-time visit, particularly if you're in the insurance network, to get through the whole host of things you want to get through. So bring in the top 3 issues, the most urgent first, and have some questions in advance that you've already thought through. Now, your doctor may have more time than you thought, and you can go on and on about other things, and hopefully your doctor has, a time. But I think you have to go in prepared to be succinct and to be clear about what you want to get done and bring your medical history updated already. That is a huge gift to the doctor to have that all right there. During the visit, I think it can be really, really helpful to acknowledge the time constraints on the doctor. You don't need to caretake their feelings. At the same time, we are human as well. And it's really nice when a patient says something like, "Hey, I know you guys are so busy and you're providing care for so many people. Thank you for taking the time with me. Here are the 3 things I'd love to discuss." Just kindness towards the doctor, empathizing with their lack of time. That can also it can be very reassuring to the doctor. It can also be nice, sort of disarming and nice. Um, I think the other thing to do is use that time to build the rapport that you need to be able to trust this person. So, yes, it's great if you can get those 3 pieces of, those problems addressed. You also want to kind of build a rapport. Maybe ask the doctor about their personal philosophy on healthcare. Share a personal detail about you, about your grandson, or something you're reading. Just establishing a rapport is such an essential part of the patient-doctor relationship. It's really the birthplace of trust between patient and doctor, which ultimately can lead to the transmission of, information and back and forth. It's a partnership. So I think to the extent you leave with maybe not all your questions answered, but you have a sense of a rapport with this person or budding rapport, that's a win. On your way out, make a follow-up appointment. Make a follow-up appointment if you didn't get everything you needed addressed. Especially if you're in the insurance industry network, just put that on the books to next time you want to talk about these 3 things, or next time you want to talk about these 4 things. Get the appointment now and just have a running check-in, like a quarterly check-in, a monthly check-in, whatever you need. Of course, your doctor may say, hey, your diabetes is pretty darn out of control. We need to meet in a month. Follow those instructions as well. But I think the point is that, this is not the last meeting. Hopefully you can meet again. Make sure you're advocating for yourself in a future appointment. So, and then the last thing is, I think there's such a power dynamic between a provider, a doctor, and a patient in those visits that I think a lot of patients feel like they have to please the doctor or win the appointment or show that they're not a difficult person or be low maintenance because they know doctors are busy. That's a big burden to carry as a patient. So I just want to make sure you are aware of the fact that you're entitled to be everything from a hot mess to a needy person to a sick person in the doctor's office. I think it's also good to acknowledge that you understand that Rome wasn't built in a day and that you're excited to build a relationship with this doctor over time. And you know that it'll take time and you're willing to make follow-up appointments. I also think it's okay to recognize that sometimes it's not a right fit. So if you visit a doctor or a primary care provider twice, 3 times, and you feel like you're not being heard, you feel like you're being rushed, you feel like the philosophy isn't there, you feel like the rapport isn't there, just switch. Like there's no prize for sticking with a doctor who isn't going to be the right fit, right? It's like any relationship. It has to be born out of trust and respect and understanding. And again, like I really don't blame medical providers in these situations for their hurried nature, for the average appointment time being like something like 7 minutes in the United States. It's the system. So acknowledge what the system is. We can mourn the loss of primary care as this like crown jewel of medicine, which it used to be in the old days. Advocate for ourselves and then find someone who meets our needs without being, expecting miracles. Um, okay, so do you guys have questions? There are a lot of really good comments you guys brought up in the comments section of my newsletter today. And it just was another reminder of how low the bar is out there. I mean, the stories you guys are telling me are stories I hear all the time from patients and friends and, relatives all over the country, how long they had to wait to get into a primary care doctor, how, much they have to advocate for their doctors talking to each other. And I think it's just a terrible burden on patients, especially when you're actively sick. So what are people asking me? I'm looking at some of the questions and feel free to add some in. Um, they wrote, thank you. Someone wrote, oh, yeah, Grace, you said the validation alone is so healing. I'm so glad. Someone said, well put. Thank you. I don't know what I said that was well put, but thank you for saying that. Um, yeah, give doctors who are doing a good job good reviews on Google because you can have one bad apple. There's somebody who I think like in 2021, when I was doing a lot of advocacy work during the pandemic, who said I was like a quack and a nut job on Google. And, my kids might agree with that, but like I think I'm pretty sane. So that just kind of like dragged down the reviews. It's sort of unfortunate, but that's okay. Everyone's, got an opinion. Their haters are going to hate. Um, so what are the questions you guys have? You got a direct primary care doctor because there's no treatment for my disease. Should I seek treatment that doesn't fit my disease specifically? That's hard to answer because unfortunately I can't provide direct sort of medical advice to people. But I would say that if you are not feeling that your doctor is understanding your complaint or not referring you to the appropriate specialist, then maybe you do need a new primary care doctor. I'm really glad to hear, Kimberly Ketchum, that you're with One Medical and have a wonderful primary care doctor. One of my former assistants went to medical school and became a primary care doctor and is with One Medical, and she's awesome. People love her, and I understand that One Medical can be great for the right person. I think it's a subscription model. I think it's relatively affordable, more affordable than like a lot of DPC. It's definitely going to be less expensive than like my practice, for example. Um, And I think the scheduling sounds really easy. It's done online and they do telehealth. Accessibility is good. So that's good. I'm glad to hear it. Lori Clark, I miss the days when I went to a PCP for an annual physical. I'd take a list of 5 or 6 things, mostly need reassurance. I felt like the doctor actually got to know me, also checked me over physically. Now I go to a Medicare wellness check, and basically there's very little physical checkup or health support. I'm sent for labs, no face-to-face way to discuss the results. I'm going to look up DPC practices in my area. Yeah, I mean, that's the sad thing. I mean, I think of doctoring as it's really a relationship business, if you will, or it's. I mean, what we do in medicine is founded in human connection, the human relationship. It's not that my relationship with my patients can prevent them from getting cancer or prevent them from having heart attack, but the relationship is essential for building trust, building rapport so that we can share information back and forth. If my patient doesn't trust me, they're not going to tell me that they have a drinking problem. They're not going to tell me that they're worried about an STD. If I don't have time to listen to my patient's whole story, I'm going to miss the fact that their childhood trauma has something to do with their eating disorder or their binge eating, which is informing their diabetes. So you have to have a rapport, and that is what I think we run the risk of losing even further if we let technology alone reinvent the healthcare system. If we let the tech bros reinvent the healthcare system using technology alone and treating the human relationship, patient-doctor relationship, as incidental to this whole medical thing, we're really going to be doing harm. Much like the electronic health records and that digitalization has become an albatross for doctors. It created some efficiencies, sure, but it's created a lot of inefficiencies, and it's sort of taken some of the humanity away from medicine. I worry that without centering the patient-doctor relationship, tech runs the risk of running over the human elements of primary care. But I remain hopeful. There are some really, really, really exciting um, entrepreneurial activities going on that I think that show promise for reinventing primary care in this country. So many practices now have online patient portals that are incompatible with each other and don't provide effective collaboration between primary care and specialists. I am so glad you brought that up, Stuart Miller, because you're right. You can have three different doctors, a primary care doctor, a cardiologist, and another specialist, and you'll have a different digital avatar in each location. So the inherent problem with the electronic medical records is that it's outdated the minute you walk out the door of my office. If you're on vacation and get stung by a bee and you get an EpiPen in the ER or something, you get epinephrine in the ER, and I don't know that, then all of a sudden my electronic health record is outdated. If you see the cardiologist that I sent you to and they change your blood pressure medicines around, and either I don't get the report or I don't have any other way of knowing that you change your blood pressure medicines, then my electronic medical record on you is out of date. Which is why I said up front, you have to keep your own medical record. Keep a open, updatable record of all your medicines, all your doses of medicines, all of your vaccines, all of your medical problems, all of your ER visits. And you guys were not trained, unless you're a medical person, to keep medical records. But I think until we have an EHR, an electronic health record that is updated in real time and that is synced with every provider you see, you have to do it on your own. Because you're right. Every single doctor has a different digital footprint of you. So I hope we live in a world someday where maybe, you have it's like a digital you that you can't necessarily, you're not going to create your own medical record. It goes through your primary care doctor, but where you go and get a tetanus shot or a COVID shot at your pharmacy and you do a QR code, on your phone, and then that gets imported to your primary care doctor, where you get a checkup with your cardiologist and they change around your blood pressure medicine, your cholesterol medication, you had a stress test. And instead of me, your primary care doctor, having to pull that record from your cardiologist, that information gets updated in real time on your central electronic health record that's shared across all providers. I hope someday that AI and technology can help us have a shared care plan for patients, a shared care plan that is designed by the primary care doctor and that is patient facing for the parts that you need to know, and that is doctor facing for the specialists you see. That's going to happen. I am remain optimistic that that's going to happen. It just could be really done. It could be done really badly if it's just tech and not about the primary care relationship. I find that in the past, this is Geraldine writing in, I find that in the past, my doctor would assume rather than prove a diagnosis. In the past, my doctor would assume rather than prove a diagnosis. That's interesting. I mean, I don't know I'm not totally sure what you're asking me there, Geraldine, but um, I think, doctors worship at the altar of evidence-based medicine, meaning we don't just put our fingers in the wind and make assumptions and make recommendations based on, how the wind is blowing, but rather based on medical evidence and the evidence of the patient themselves. So I hope that you have a doctor who uses medical evidence and centers you in the medical evidence for decision making and making diagnoses. Um, Grace is writing in, the issue for me has been how defensive doctors become when I'm self advocating. That's a great point as well. Um, Not to defend defensive doctors, but I think you'll understand because you're obviously an empathetic person. Um, I think that doctors are burned out. I think that unless you've created your own way of practicing medicine where you can do the kind of medicine you were trained to do, like many of us in DPC have done, um, you're pretty burned out and you're so familiar with the complaints about your lack of time, your lack of attention. You're so exhausted. You know the patients want more time and you want to provide more time and you can't. And you're getting paid very little and you're being told you're not doing a good job. Like that kind of moral injury is pretty profound. Um, and then you see the insurance companies and the insurance company executives making, you know, a gajillion dollars, and the big pharma CEOs making a gajillion dollars, and watching the health in the average person in this country get sicker and sicker and sicker, despite the fact that we're a rich country. I think that the moral injury on doctors is huge. So I think that doctors are primed to be defensive because it isn't our fault. It is not our fault. It is the system's fault. So it's not to excuse defensive behavior, excuse defensive posture, or I just think that there's a reason for it. And that's why when I said up front, I think the more you understand this landscape and understand the position that doctors are being put in, it's not to excuse it, it's to say you can meet that reality and meet your doctor where he or she is by saying like, "Hey, I understand you guys are stretched thin." Um, and advocate for yourself because just because they're stretched thin doesn't mean they shouldn't provide care for you that's appropriate, that's thorough, and that's humane. So, an FQHC is a federally qualified health center. It's a federally funded community health center that is designed to provide comprehensive care regardless of how you pay for it. Let me give you that website again. It's where was that? I put it up front. It's oh Lord have mercy, I can't even. The website is www.findahealthcenter.hrsa.gov. hrsa.gov. There often are shorter wait times and again, financially feasible for a lot of people. Um, you are having trouble getting, so someone else is writing in here, I'm having trouble getting my doctor's attention due to an overload of patients in her care. Enough doctors, not enough doctors, they claim. Yeah, I mean, I think it's true. I think that I think that there are too few doctors, and when you have too few doctors and more patients needing care, they are overloaded. Um, and I think that's just the sad reality of the situation. It's not an excuse, it's just where we are. Um, so I'm looking at other questions. Um, if they don't hate you for it though, I don't know what you're talking about, but I'm sure that was amusing what you um I am just looking at any other questions. Grace, can we be real that this empathize and hold accountable issue is almost impossible paradox to straddle. It's exhausting to keep paying for new doctors because we know and directly say it's the system, but very, very few doctors have the capacity to empathize like you do, Dr. Lucy. That's nice. They almost always get defensive. I mean, look, doctors are, as diverse as the stars in the sky, their personalities. But I think in general, I'm speaking very generally, we are a cohort of people who want to solve problems. We want to fix, we want to help, we want to heal. And I think that, and again, I'm not trying to excuse doctors who are misbehaving, short, rude, defensive. I'm just saying that the pressures on doctors in insurance systems, in big academic centers is enormous. And some people just shouldn't be in the field. I mean, some people should not be in the field. Let's acknowledge that. There are people who, shouldn't be practicing medicine because they're so burned out, because they're mentally unwell, because of burnout or for other reasons. Like doctors are human too. But I think you're right that doctors can be very short. Like, let me give you an example. I had a patient who had colorectal surgery. This was like, I think in the spring. And she had a complication from it, and she couldn't get in to see the colorectal specialist for the complication from the surgery. So it was Friday afternoon, and my patient was kind of desperate. And I said, come on in here and I'll talk to you. I mean, I'm not a colorectal specialist, but it turned out she had a stitch that was left in her bottom that was very painful. So I decided, as her primary care doctor, as my patient's advocate, to call the colorectal surgeon. And mind you, I'm not calling the doctor to scold her. I'm simply calling to coordinate care and to advocate for my patient. And this doctor was mad as a hornet when I got on the phone. She was mad as a hornet. It took a while for me to get through. I had to wait on hold. I had to have my secretary call. I had to call back. But this doctor, even to another doctor, her posture and tone on the phone to me was mad. It was defensive. And so I could tell right away. I said, Doc, let me just say this right now up front. I'm not calling you to scold you or to get mad. I'm calling you to advocate for my patient. I know you are busy. You probably were in the operating room all day. It's Friday afternoon. I get it. I am just trying to ask you how I can help you help the patient on Friday afternoon. How can I help you help the patient? And she disarmed herself a little bit and she got a little nicer. And she confided in me that she was so burnt out from all the demands on her time. And because she'd been in the operating room, she had messages up the yin yang that she had to answer on the portal. And I get it. I'm not excusing her behavior. I'm just saying that this is the reality of medicine in America right now. And we could complain about it. And man, I complain about it too. I'm a human too. I have to navigate the system for myself. And, it's not easy, even if you're a doctor. But I think we need to just understand what the limitations are on doctors' times and how to advocate for ourselves, because no one's going to do it for us. And the odds are kind of stacked against us. Interesting. You're writing in here, MGD, that my concierge doctor has never examined me. We talk about issues and she looks at blood tests, but she has never touched me, even though I have significant abdominal issues. Is that weird? I think it's a little weird. It is interesting. Like, in the old days and like medieval times, all we had was the physical exam, right? And now with modern technology, I think medicine is moving towards, imaging studies, CTs, MRIs, sonograms, and like lab work as a proxy for physical exam. But physical exam has a physical examination has a number of important elements. Number one, it tells a story. It tells a story. I mean, you can tell based on a physical exam of someone's abdomen. I mean, most people can tell, most primary care doctors can tell what's a gallbladder problem, what's an appendix problem, what's a diverticulitis problem, what's a pancreatic cancer problem. You can't tell for 100% sure, but the physical exam tells a whole story that cannot be told by lab work or imaging. Now, in the old days, even like 20 years ago when I started practicing, patients would come in having found their own breast lump, which turned out to be breast cancer. Nowadays, mammograms are so sensitive that it's unusual for a patient to have a breast lump that's cancer when they've been having mammograms. It can happen, but mammograms are so sensitive nowadays. Unless you've not gotten mammograms, people are unlikely to find their own breast lump or for me to find a breast lump on just a routine exam. Do I still do breast exams? Absolutely. I do a breast exam on a patient even if they've had a breast exam that same morning with their gynecologist. It's part of my job. The other part of physical examination and that is that the human touch, the human connection is part of doctoring. It is part of establishing a rapport. It's a part of laying on hands. There's a psychological element to it that goes beyond just the diagnostics. So, not to mention that I've picked up more thyroid nodules and lymph node enlargements and suspicious moles. And you can also look at someone, affect and understand by their body language how they're doing mental health wise in many cases. So, yes, I think physical exam should always be part of a primary care, annual exam and for problem-based visits as well. But unfortunately, it's being kind of phased out by many doctors and providers because it's thought to be not as useful as other modalities. But maybe I'm just old-fashioned. Maybe I'm just old-fashioned. Um, how do you speed up the time to find a PCP or an appointment with a specialist? Tom, I don't think there's a magic way to do it. I think what I would do is try to get on the wait list or on the appointment schedule of like 3 or 4 doctors, get on their ask their assistants or their front desks to put you on cancellation lists, and then get in with the first person you can see. The role of the primary care doctor, if they're doing their job, is to also help you coordinate care. So if I see that a patient of mine needs to see a specialist like urgently, I will get on the phone to advocate for them. But that is not always the norm. Um, let's see. You have records, Claire, on multiple portals, and all of them have inconsistent and incorrect things in them. This has been so upsetting. Everything is so fragmented and exhausting. I totally hear you. As I said a couple of minutes ago, you have a different digital footprint in every medical space you've been. So you need to be careful about keeping your own records. And when you see a specialist, make sure that they have your primary care doctor's fax number, phone number, and even ask them to send their summary letter to you directly. Yeah, you've got to be your own secretary, your own advocate. It's really unfortunate. Um, Michael Teferi, I wonder what to do about my medical conditions. Granted, I have a cardiologist, so he's been wonderful. Specifically, do I try asking my primary care physician to refer me to a doctor who specializes in hypothyroid or hyperlipidemia or whatever it's called? I mean, that I don't know because that's just, you know, primary care doctors, if they have time, they should be able to manage hyperlipidemia. They should be able to manage hypothyroidism, sort of bread and butter stuff. If they aren't comfortable, and they should tell you if they're not comfortable, of course, then they should send you to a specialist. And then the specialist at the end of your appointment should write a letter or summary note to the primary care doctor with the findings. So that is all coordinated and the recommendations land in your primary care provider's office. Um, so my internist is retiring. I have 2 docs I'm considering, both popular. Um, One is 65, the other is young. Which should I go with? That is a great question. So the benefit of having an older doctor is that they have had a lot of experience and they have a lot of accumulated knowledge that a younger doctor won't have. The benefit of a younger doctor, of course, is that they're probably going to be practicing for a whole lot longer. They may be more, I don't know, maybe they have more zippity doodah, maybe more energy. I don't know. And not to be ageist, but maybe by the time you're 65, if you've been practicing in the system for 40 years, maybe you're ready to retire. I don't know. Some of the best doctors I know are my colleagues in their 60s and 70s. The senior partner at the old practice was practicing in my old practice was practicing into her 80s, and she was phenomenal, a real role model. So I don't know. I think it just depends on who you click with, who you jive with. Is it crazy to make an appointment with both and to see who you connect with better? Um, I don't know. It's up to you. It depends. So many medical portals have data breaches also. Yes, that is so true. Data breaches. Um, uh, if only there was a way to create that kind of all-inclusive profile securely when there is a for-profit system working directly against our actual well-being. Talk about tech bro problems. Yeah, I mean, AI is coming for healthcare. And I think, as I said earlier, it can be done well if patients' privacy is honored and if doctors are helping shape the technology instead of the technology shaping doctors, if you know what I mean. Okay, let's see. The exhaustion I face from the insane fragmentation of medical information, people writing inaccurate notes is crazy. I totally agree. Totally agree. Someone's recommending you get a lawyer. I think you guys could talk amongst yourselves because everyone has these experiences. At what age, Virginia is asking, should a person secure a primary care doctor? Well, I mean, my kids are in their late teens and early 20s, and like my son just moved to New York, and I want him to get a primary care doctor in New York. He just moved, so he has time. He can use the urgent care for like strep tests and COVID shots and stuff. But I think in the 20s is when you should get a primary care doctor. I mean, I think you want to establish a relationship early because you never know what problems are going to arise. I have many, many patients who use their gynecologist as their primary care doctor, like when they're in their 30s and 40s. But even then, I think you should have a primary care doctor because primary care, we are trained specifically in, managing all the various organ systems, endocrine, cardiology, GI, neuro, um, metabolic health, menopause. Like we touch all the different elements of people's health, mental health. So I think the sooner the better. It's just about finding the right person. Um, why hasn't a standard intake form been developed and implemented for gathering and updating health information that does not reside out there somewhere? I mean, amen. Who wrote this? This is a great question. Is this Virginia still? I totally agree with you. And I think one of the important elements of healthcare that needs to be reformed is just that. We all know how annoying it is to come to a doctor's office, a doctor's appointment, where you filled out forms in advance online, and then you're given a clipboard at the front desk. Fill out these forms. And you're like, well, didn't you get the forms that I filled out last night on my computer? And then you fill out those forms, and then you go and sit with the medical assistant, and they ask you the same questions. And then the doctor asks you the same questions. And then you do it again next time. So, yes, there should be a central set of questions and an intake form, and there should be a central electronic health record that exists, the digital you that is updated in real time, that your primary care doctor helps curate, and that that includes a shared care plan, like based on your goals for either your diabetes or your depression or your weight loss, and that has a specialist facing view and then a patient facing view and a primary care doctor facing view. I do believe I could be wrong, but I do believe that is coming. I do believe that is happening. And if I have anything to do with it, it will be comprehensive. It will involve the patient and inputting their biographic data. It will involve technology, but it will not outsource the patient doctor relationship and the importance of that, because a digital footprint of you is not the same as you as a living, breathing individual who's making decisions about their health every day, whether you know it or not. So I have great hope about technology improving the primary care experience for more than, for large swaths of the population if it's done well. But until then, I think you need to find a good primary care doctor, someone who understands you, who has time for you, and who is able to coordinate care. And in the meantime, if you don't have that person, write everything down, keep it all in a log, advocate for yourself. Don't expect anything less than healthcare. You need not just episodic transactional medical care, you need healthcare. And I hope that at some point in my lifetime, we have that for all people, not just people who can afford it. And I think you can vote for people who believe in whole person care. I think you can advocate for this, in your communities and with your families. And I wish everyone the best. I think we all deserve access to primary care that serves us, that centers us as humans, and doesn't just treat us as a set of labs or a bag of organs. And I hope that exists in my lifetime. I hope this was helpful. I will see you, I think, next week. I don't have a guest for next week, and it's Labor Day, right? Or no, it's the day after Labor Day. So I'm not sure I'm going to be here next week, but I may. I hope this is helpful. There have been like over 200 of you guys on this phone call. Thanks for commiserating. Thanks for sharing your stories. And I will see you next time. Bye.